Welcome back. We're going to quickly wind this up. We only have a couple of pages of notes to kind of go through here. And again, if you're accessing the notes through the internet, you can follow along. You can pull the notes out and follow them along as you're watching the videos. I'm going to talk just quickly about private health insurance. It kind of encompasses, we've talked about the providers. There are some public agencies that get in, I guess, that impact private health insurance to some extent. You've got some not-for-profit foundations that are out there functioning in this, kind of on the periphery of the private insurance market. Sometimes they're substitutive, sometimes they're complementary, sometimes they're supplementary, but when you've got a diverse population, not only a diverse population in with regard to age and ethnicity, but also a diverse population when it comes to wealth and income status, it takes a lot of different types of agencies to pull the necessary healthcare market together, so that we can provide the access that everybody within the community requires. And so that's why you've got everybody working together. And again, it's healthcare is definitely not to me, definitely not a competitive market in the sense that we define, true market competition. But it's definitely, again, from my perspective, it's definitely better than socialized medicine. And socialized medicine, we're not going to get into it and spend a lot of time on it, but typically socialized medicine, you've got workers, you've got employers, and you've got government agencies paying into the socialized medicine pool. And then I don't want to get almost like on a first come, first come, first serve basis. So to me, it's, from a social net benefit perspective, I'm going to take the free market healthcare environment we have here in the United States over socialized medicine. And one comment I want to make sure that, and I've mentioned it a couple of times so far, health insurance increases the level of healthcare demanded depending on the out-of-pocket payments. And when I say the out-of-pocket payments, I'm talking about the out-of-pocket payments that a consumer is going to make. And remember, we talked about coinsurance, deductibles, copays. There's another option out there now that's a high deductible health plan where you are paying. Basically, the way it's, at least it worked for companies that I've been employed with in the past, they will pay you either for yourself, it's typically for yourself or for your family. Your employer group will kick in, say, $1,500 or $2,000 towards your deductible, and then your deductible is either $2,500 or maybe $5,000 for a family, and they've kicked in this amount of money. You can use it to pay your deductible up until it hits that, whatever that deductible limit is. And then from that point in time, the health insurance kicks in and they help, make up the difference. So that's kind of what a high deductible plan is. And when insurance reduces the monetary cost, then it's the time costs that become important. Increases in wages increase the time cost for healthcare. Go back to the example I've always used about myself. Somewhere 2.5, 3 hours is the amount of time I have to spend to go see my primary care doc from the time I leave my house until the time I get back. And my time is worth something to me. And that's what they're talking about, time cost. And the higher your wage rate, so the more money you make, the more valuable that time cost is going to get. As a student, you may have a wage rate that's not that great. And so maybe your time cost is not as big an impact as it's going to be once you get out into the workforce. And let's say your annual salary from between time you're a student until you get out in the workforce, it's going to multiply by, by some multiplier, 2, 3, 4, 5. I don't know what the multiplier will be, but something. It's going to increase that wage rate. And as it increases the wage rate, the time value or the time cost that you spend going to see a healthcare provider is going to become more and more valuable. Supply and demand of healthcare is determined by the level of insurance in a given market, because it's always going to come down to it's a marginal benefit, marginal cost, functional relationship. Remember what I said when we first started, I guess, segment 2, I said it's utility on the consumer side, it's profit on the plan side, it's profit on the provider side. And all 3 of these players in the market are equating marginal benefit to marginal cost. And at the end of the day, what policymakers are looking at, so you've got private insurance, you've got CMS that's providing Medicare and Medicaid, you've got DOD that's providing TRICARE, and then you've got your private health insurance. You've got some, public clinic, community clinics. I think there's a community clinic close to Fisk campus. It's down there on the corner of 14th and maybe Jefferson Street. I've seen a community clinic somewhere down there. But again, what you've got is you're trying to maximize the net benefit to society. That's what policymakers are looking at. They're trying to say, what can the government do, local, state, federal, what can the government do to help maximize that net benefit to society? When I'm talking about the net benefit to society, I'm talking about provide access to all of the individuals in that consuming population. And tax benefits erode social welfare by generating levels of insurance that are suboptimal. It reduces the optimal supply of services. And that's what typically happens when policymakers, and it doesn't matter whether it's, price floors for agricultural commodities, price ceiling for rent controls, or tax, excise tax on your gas, or they're talking about tax benefits here in healthcare. It ends up providing, in many cases, negative benefits or reducing the net benefit to society. Access to employer-based insurance has reduced the level of uninsured consumers. And I think that was probably a valid statement up until Q4 of 2019. And we've talked about it. Q4 of 2019 is when you started hearing the rumbling about COVID. Q1 is when it was full blown in the United States. Q2 is about the time that pretty much the economy shut down. And as businesses had to close their door, what happened? Individuals lost access to health insurance. So you're starting to see the economy, especially in maybe late 22, but in 23, you're starting to see the economy start to revive, and you're starting to see more of these uninsured come back into employment rates are, supposedly dropping. So, if you believe those numbers, that's great. But as more and more individuals come into the workforce, the potential is there for more and more individuals to start receiving some type of employer-based health care. Employers are reducing their level of insurance payments and offering employees the opportunity to purchase coverage above the base level plan. And then you've got, as I said, high deductible health plans, higher consumer-based subsidized premiums, and that's what you're doing as a consumer. You're subsidizing that healthcare premium to that benefit plan that your employer group has purchased for you. And they're trying to break things now down into it's either a single or a family plan. A lot of employer groups now don't offer single, single plus spouse or family. It's just either single or family. And if those are the only two options, and you're a single individual working for that company, I will guarantee you that you are supplementing through payments that you're making to your employer group. You're supplementing and subsidizing the health care that individuals working for that company with the family have. And then you've got also impacts on private insurance, especially. You've got increase in Medicaid payments or increase in individuals that are accessing Medicaid. You've got dual earner families, and you've got decreased in unions. Unions decrease, it's going to impact the level and especially the magnitude of private health insurance. So those are just some topics. We've trying to wind this thing up with those topics. And the next time you see me, we're going to jump into the next chapter in Dewar's text. I hope everybody's enjoyed talking about insurance. There are a lot of topics that we didn't cover, but been trying to give you more of a flavor and a high-level understanding of health insurance. And a lot of these issues we will continue to discuss and maybe get into more detail as we continue through Dewar's text. Next time you see me, we'll be jumping in a new chapter. Talk to everybody soon. Thank you.